Hey everybody, so in this video I'll be talking about dental crowns. What is a dental crown? What does it mean for you? And what are some factors you need to think about when you're making your decision of getting a dental crown? So essentially a dental crown is a cap. It's a cap that covers a tooth. It is our job as dentists to inform you to make the best decision for yourself and to do as great of a job as possible to deliver the best possible treatment for our patients. So we know that a dental crown is a coverage that goes over the tooth, but there's many different forms. There's a full coverage crown, there's a partial coverage crown, and there's a special kind of crown, aka a veneer, which is essentially a partial crown. And in this picture, we have three different types of coverages. We have the full coverage, which is the middle one, and we have the onlay and the inlay. The onlay and the inlay are actually partial coverage caps, which means that we don't shave down the entire tooth to put the restoration on. And what that means for you is that we're as conservative as possible. We hold as much tooth structure as we can, and there's less possibility of things going wrong depending on the situation. So why do we need crowns? Here's one reason why we need crowns to cover our teeth. So this is an extreme example of a patient that's worn down a lot of their teeth. And we can see the yellowness on top of the teeth. And that's a great sign that we're grinding at nighttime. We might be putting a lot of pressure on our teeth during the day through stress, or we're not wearing a sports guard when we're doing high level activities. And what that does is that it shaves your teeth into nubs. And as the teeth become shorter and shorter, they're less strong and they're more likely to break, fracture. So we need to protect them as soon as possible. Even though our teeth are the hardest things in our body, they can break, and I'm sure you've seen someone. Depending on how bad the breakage is, we can actually restore the teeth with a crown or an inlay. Or sometimes our teeth break so badly down the middle that it splits in half and there's not much we can do. And no, we cannot glue it back together. It's just not possible. You will get an infection if we try to glue a tooth back. Now, what about small little fractures? Situations where our teeth haven't fully broken, but we start to see little cracks. And this is super common in people who have silver fillings. 10, 20, 30 years ago, amalgam fillings or the silver fillings were the first choice in restoring teeth. And what happened was that these silver fillings caused little tiny hairline fractures in the teeth that got bigger and bigger over time. And one day when the patient is eating something, they bite on something, even the softest thing, and the whole tooth fractures. Now, what about fractures in the front? This is actually a very controversial topic, because in these kind of situations, we can restore our teeth in two different forms. One is a veneer, that's a partial crown that goes over the teeth, or we hand sculpt composite in our dental office to patch the fractures. And this can bring so many different outcomes for our patients, depending on the skill level and expertise and philosophy of the dentist. A problem where we face between deciding whether to fix a front tooth that's really broken or slightly broken is how well we think as dentists the restoration is going to last, right? This is an example where the fracture is so bad that no matter how much composite that we might add to the teeth, it's still going to fracture because there's nothing to hold on to it. So in this case, we might opt out for a crown or a veneer. This is a really small crack, right? And because we have a lot of tooth structure to hold on, we can actually not shave down the teeth and put just a little layer of composite that's not noticeable, that blends in perfectly with the teeth, and we fix the problem. Another reason why we might need to put a crown or a partial coverage crown is there's so much decay and cavity on the tooth. What happens is because of the size of this decay, we can't simply put composite or filling material over it because it's just gonna fracture, it's gonna break. It's just not strong enough. The crown materials that we have are usually made out of ceramic that's made in the laboratory, and the strength that they have is much stronger. So if you want to cover something that has a really big decay, that has a really big hole, we need to put something strong and big inside there instead of something that is designed like composite for smaller situations. Another reason why we use crowns is to actually restore a tooth after we do a root canal. And this is super important in the back teeth because we have a lot of forces in our jaw we do a lot of chewing with our back teeth. When a tooth is root canal treated, it's very fragile, which means that we need to put a crown to help cover it, or else it will break. And time again, I see this all the time, that a patient comes in for the root canal, but they might miss their crown appointment, and a year later, 6 months later, even a few months later, the tooth snaps in half, and then we gotta do an expensive implant. But the exception to this rule that is in the gray zone is when we do a root canal in the front, we don't always have to put a crown on top of it. And that's because we don't put a lot of forces, we don't put the same type of forces in our front teeth as we do in our back teeth. And this is actually a good thing, because when we want to restore a front tooth, we want to make sure the color blends in. We want to keep it as natural as possible. This is the basic video about crowns, veneers, and partial crowns. We can go really deep into this with the type of material, same-day crowns, the types of preparations that's involved. But I hope this video helps you understand why we put crowns and why it's so important in our day-to-day practice.